Hello and welcome to my presentation on the roles and responsibilities of the midwife. The main objectives of today's presentation is to discuss the recent changes and the impact it has had on the roles and the responsibilities of a midwife, a discussion about the impact of the midwife in meeting the physical, social and psychological needs of a woman and her family, a discussion of the role of the Nursing Midwifery Council in relation to midwifery practice, an analysis on the implications of the code on midwifery practice and the role of the midwife, an explanation of the need for effective communication in a multidisciplinary healthcare setting, and finally an evaluation of the effectiveness of multidisciplinary approach in a healthcare setting, including the positives, limitations, effectiveness of the multidisciplinary approach to midwifery practice. So that's what I've just read. So first we're going to look at the recent changes and how they have impacted the roles and responsibilities of the midwife. Midwifery became legally recognised in Britain in 1902 with the first Midwifery Act. Despite this, there continued to be a large proportion of women who were supported by midwives who had not been formally trained. Before the First World War, in some areas until the mid-1930s, the majority of working class women in Britain were attended in childbirth, not by a professional but by a local woman. The Midwives Act allowed for lay midwives to continue practicing as there were so few trained midwives at the time. However, there was a timescale attached to this. By 1905, all midwives had to be registered or they could not call themselves midwives. After 1910, bona fide midwives could no longer legally attend births without being under the supervision of a certified midwife or doctor. This major change made births safer for women and began to prevent avoidable death and serious complications in mothers and babies during pregnancy and birth. When the NHS was established, women were encouraged to give birth in hospital and were advised to stay in for up to 1 week where they would be supported by midwives. There have been many changes that have happened over the years that have shaped midwifery practice into how it is today. These factors include educational, legal, organisational, financial and social. I am now going to elaborate further on 2 of these. So educational. To become a qualified midwife in the UK, you are now required to complete 3 years of studies at a university of your choice, which will educate you to a degree level. Standards of education and training are now set by the NMC, which all midwives have to be registered with in order to practice in the UK. Midwives are required to complete regular refresher training in order to keep their PIN number and be recognised as a qualified practitioner. Legal. The Order 2001 established our organisation and sets out our primary purpose of protecting the public, the structure of the organisation, and our functions and activities. The Order also sets out some binding principles and oversight arrangements for us. We are accountable to the Privy Council, the Department of Health, and the Professional Standards Authority. In a NICE report, it was recommended that women should be cared for by a named midwife, and that this midwife would be the same midwife responsible for the woman's care throughout the antenatal, intrapartum, and postnatal period of our pregnancy, so there was a continuity of care. Research has shown that women value this in their pregnancies, although we know today this is difficult to achieve due to staff shortages and a rise in births in the UK. In 2016, the Better Births Report was published with a vision to improve maternity care and standards over the next 5 years. The report sets out the planning, design and safe delivery of services, how women, babies and families will be able to get the type of care they want, and how staff will be supported to deliver such care. A midwife today will be required to practice autonomously to attend women during antenatal, intrapartum and postnatal periods. There will be a prime care provider requiring supervision and preceptorship and will work as a member of a team providing maternity care within hospital and community. All midwives are required to work within the framework of the NMC midwives' rules and standards and the hospital trust protocols and guidelines. They're required to give care throughout the antenatal, to advise on the promotion of health and seek advice and support to ensure that health needs of women are addressed. They're required to recognise physical, emotional and social situations which may influence the health and well-being of the mother and the baby. To assess, plan and implement care with the sphere of practice of a midwife to meet physical, emotional, educational and social needs of the mother, baby and family. To take action in initiating the action of other disciplines and seeking assistance when required. To demonstrate competence in midwifery practice. To interpret and undertake care prescribed by a medical registered practitioner. To demonstrate effective communication with mothers, relatives, colleagues and others from different disciplines. To seek support and care for women and families where there are emotional and distressing circumstances. To demonstrate an awareness of the importance of research-based practice. To work within a multidisciplinary team. To have an awareness of clinical governance. And to have an awareness of the value of midwifery supervision. Next, we are going to look at the impact of the midwife in meeting the physical, social and psychological needs of a woman and her family. So, the midwife is responsible for the maintenance of a lady's physical health when she is pregnant. The pregnant woman is regularly assessed during antenatal appointments and will have her blood pressure checked to check for preeclampsia. Urine will be checked regularly to look for infection, and a healthy diet and lifestyle is recommended. Women are also advised to take Healthy Start vitamins to support the mother's and baby's growth and development. There is now also blood tests which women will have, which will flag up gestational diabetes, and these are offered to women that have a high BMI and those that have had diabetes in other pregnancies. There are also routine blood tests that women will have at booking and then again at 28 weeks. These simple checks can potentially save a pregnant woman from becoming seriously unwell during her pregnancy. A woman will be also offered 2 routine scans at 12 and 20 weeks to check for any abnormalities with the pregnancy, and this will also give an estimated due date for the unborn. After birth, the midwife will monitor the mother's recovery, checking the perineum, breast and uterus. She will also check the baby for jaundice, weight loss and perform a heel prick test which is sent to Great Ormond Street to check for cystic fibrosis. Advice on safe sleeping and how to make formula safely, if this is what the family have chosen to do, can also be given. During appointments, there is a series of questions that women are asked regarding her mental state and whether or not they have suffered from any mental health issues in the past. Within midwifery, there is now small teams that will take over the care of women that require additional support to ensure that they get all the support they need during and after pregnancy. A woman will also be asked sensitively about her relationship with her partner and whether or not there has been any domestic abuse. Many women suffer from postnatal depression, so midwives are also responsible for looking out for key indicators of this. Women will be referred to their GP if medication or additional support with health needs and conditions is needed, which falls outside of a midwifery scope practice. When a lady has given birth, life can be very different from what they have previously known, and often women feel very isolated in their own surroundings. Midwives will give ladies with information regarding groups they can attend both online and out in the community with other pregnant women. so they can form new friendships and get support from other families. These groups include antenatal classes, which provide all information you need during pregnancy, birth, and after the baby arrives. There is also breastfeeding support groups, stay and play groups, which are run by local children's centres, and regular weighing clinics, which are run by health visitors, where families can go with their babies for advice and support up until the child turns 5. So next we are going to look at the role of the Nursing and Midwifery Council, also known as the NMC, in relation to midwifery practice. The NMC is all about keeping both patients and staff members safe. The NMC sets the standards and guidance in which nurses and midwives are obliged to follow in order to practice. They provide support and regular trainings to staff and require midwives and nurses to revalidate every 3 years to ensure they are up to date with their learning and able to offer the best possible care with the correct knowledge. If there are any errors in practice, the NMC will carry out their own investigation and provide further support or training where necessary to improve practice and patient safety. The NMC hold a register of approximately 758,000 staff members in the UK, so you can check who is cleared to work as a qualified nurse and midwife. Any complaints from service users will also be investigated by the NMC and necessary action is implemented. The NMC are also available to support all registered staff members with anything that they need in order to maintain their safe and effective practice. So next we're going to analyse the implications of the code on midwifery practice and the role of the midwife. So the NMC published the code in 2015, which was updated in 2018 to reflect the validation of nursing associates. This presents the professional standards that nurses, midwives and nursing associates must uphold in order to be registered to practice in the UK. It is structured around 4 themes, which I've shown on my slideshow. They are to prioritise people, practice effectively, preserve safety and promote professionalism. It acts as protection to the public so that people are not able to practice if they have not been fully trained to the highest standard. By joining the register, you are committing to adhering to the requirements at all times. If you are found not to be practicing this way, you could result in prosecution and the removal of your PIN number, which would mean you are no longer able to practice in your profession. I am now going to analyse the 4 P's to the code. So to prioritise people, patients should be respected and treated in a non-judgmental manner. Their needs and wishes are to be at the forefront of the treatment and midwives should prioritise this in their approach. If this was not delivered, the public would lose confidence in the service. Patient's consent is a requirement before any procedure is performed. To ensure you practice effectively, midwives need to ensure the care given is appropriate and safe for the patient in order to have the best outcome. Clear communication skills, both verbal and non-verbal, are required, and a clear explanation of the treatment we are given is needed at all times so that women understand their own clinical needs. To preserve safety, midwives are expected to deliver care in a safe and timely manner and need to recognise their own limitations to avoid unnecessary mistakes and dangers to women. Additional guidance and support is to be sought where appropriate to do so. Accurate record keeping is essential in order to ensure care is handed over correctly. To promote professionalism, midwives must remain professional at all times and respect their colleagues, particularly in front of patients. Midwives must promote NHS guidelines and visions and not give any individual opinions or share any personal experience with patients. Midwives need to be mindful about how they use social media and not breach any confidentiality. Lastly, revalidation requirements require a midwife to work a specific number of hours in practice. They rely on feedback, confirmation, reflection, and discussion. So next, we're going to look at an explanation of the need for effective communication in a multidisciplinary healthcare setting. A multidisciplinary team is a team working collectively with the patient being at the centre of their work. Combined knowledge and expertise ensure that the pregnant woman receives the individual treatment package that they need. Effective communication between healthcare professionals should be clear, timely, and discreet. The communication is needed to make accurate diagnosis, ensure the treatments are appropriately provided, and to ensure that patients understand their own health status and need. It is important to give patients choice so that they understand why certain tests or procedures are recommended, giving benefits and risks so they are able to make informed choices about their own care they wish to receive. Patients' consent is at the forefront of everything the NHS stands for. An example of a multidisciplinary approach for a woman could be a lady that has a diagnosis of gestational diabetes during pregnancy. The team around the patient would consist of the midwife, the gestational diabetes midwife, the sonographer, and the obstetric consultant. It is vital for accurate record keeping to be well maintained for this way of work to be effective. Next, we are going to evaluate the effectiveness of a multidisciplinary approach in a healthcare setting. Working with a multidisciplinary team allows you to treat the entire patient and provide comprehensive care, with each doctor focused on a different aspect of the patient's health. Providers are more likely to identify areas of need and subsequently manage those needs in a more effective way. One disadvantage of a multidisciplinary team discussion is the lack of patient involvement, since patients are not always present at these meetings. If patient preferences or social circumstances are not taken into account, team decisions may be inappropriate or rejected. Some of the limitations to work in this way could be there is always a time pressure involved in providing services. Different team members come from unique backgrounds. It requires frequent collaboration to be effective, which can prove difficult with different services having different shift patterns and different resources available at the time. Also, working in different areas within a healthcare setting have their own waiting lists and time frames for delivery of care, so this could have an impact on how timely the patient will be treated. A multidisciplinary approach is effective and it ensures the patient's health needs are not overlooked and appropriate care is given at the right time by the right service. It can allow patients to create their own goals and creates new avenues for different service implementation. In conclusion, a midwife has a vast range of roles and responsibilities which vary greatly dependent upon which area you are working at the time. They have changed significantly over time to improve the rate of safer births and positive outcomes for families that they work with. There are guidelines in place to ensure each midwife is practicing effectively, and most importantly, safety, and the same care is offered to service users is consistent across the NHS, assuring each patient is given care to support their own individual needs. Thank you.